Meeting back to order. Mr. Richards, why don't you take the roll for us this morning?
Good morning, members of the committee. Representative Kinner.
Here.
Representative Larson.
Here.
Representative Schwartz.
Here.
Representative Simpson.
Here.
Representative Stith.
Here.
Representative Walters.
Here.
Senator Guru.
Here.
Senator Hicks.
Here.
Senator Kinski.
Here.
Senator Steinmetz. Co-chairman Nicholas.
Here.
Chairman Perkins.
Here.
Mr. Chairman, you have a quorum.
Thank you. So anyway, here we are. We're back. The first agency that I think we're taking up this morning is the Department of Health. Is that right, Don?
Yes, Mr. Chairman.
All right. So we're gonna go back and we're picking up a couple that we skipped yesterday, so that we had our experts on our respective committees on a couple of agencies back with us today. So we're glad of that. And so we're going to come back and go back in numerical order to the extent we didn't catch them yesterday. So with that, we're in the director's office. Before we start, Mr. Co-Chair, do you have any comments or anything you'd like to say this morning?
No, I'm ready to go.
All right. All right, Don, let's go to work.
Mr. Chairman, the first unit for your consideration appears on page 74, the director's office.
Move GovRec.
So GovRec is the standing motion. So we're on. Go ahead, Don.
Sorry, Mr. Chairman. Before you take any votes on this agency, now would be, or later, would be an opportune time to consider a global motion as to the Department of Health in the treatment of their estimated $76 million of carryover.
And I think after discussion, we were talking about changing that. I think we came to the conclusion it's going to complicate matters too quickly today. If we're going to do that, I should have spoken up a little bit earlier. But I think what we do want to do is that we do want to report from the department's office. We were talking quarterly on just how the reversions are being expended. We'll just see where that goes. So I'm making my own motions today. So that's actually, let's make that Senator Larson, or Representative Larson's motion. Is there a second? All right, we got that seconded. Discussion. All right, all those in favor say aye.
Aye.
Those opposed, no. We're back on, the motion carries. We're back on the original motion, which is GovRec. Any other further on this unit? All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don, next.
Mr. Chairman, the next unit for your consideration appears on page 80, vital statistics.
All right. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, hang on just a second.
Hang on. All right,
I'm looking-
timeout. Senator Kinski.
I'm looking at Elizabeth's spreadsheet and the next one I show is 85. So I'm just trying to see where I'm getting off track.
Mr. Chairman, I believe
We're on
the
one on
list of
80.
it.
We're on 80 right now, so we're not 85.
Right, I didn't, Elizabeth's spreadsheet doesn't have an exception on page 80. I'm just wondering what I'm missing here.
Nothing. It's just this unit. It's just the unit.
I see, we're closing the unit. Okay, I'm with you.
So
I'm
we're
back.
just, so we're on, so the.
Gotcha.
So, and granted, a couple of you guys were here, so you missed our flow yesterday. So
Okay.
the standing motion is GovRec. So we're here at unit 130. And so which is on page 80. And so the motion is GovRec. I don't think there were any exception requests for this that if they are, they were taken care of with the global motions we made yesterday. So GovRec, all those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 93. It's HCF administration, and pursuant to the agency's hearing, I believe they indicated that $101,784, which was requested in general funds and appears on page 88, should in fact be federal funds.
Okay. Motion. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don't want anything else.
Not on that unit as amended.
All right. As amended, all those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 97, the Children's Health Insurance Program, S-CHIP.
That's correct. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 100, Medicare Part D clawback.
Medicare Part D clawback. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 103, dual eligible excluded drugs.
Dual eligible excluded drugs. Those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 106, Medicare Crossovers.
All those in favor of Medicare crossovers say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 109, Medicare buy-in premiums.
All those in favor say aye.
Aye.
Those opposed, no. Medicare buy-in premiums approved.
Mr. Chairman, the next unit for your consideration appears on page 111, Wyoming health insurance premiums.
Wyoming healthcare insurance premiums. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 116, adult services.
Adult services. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 120, children's services. On this, Mr. Chairman, there is a need for a correction in the revenue, special revenue fund 5005 should in fact be the school foundation program, fund 9.
Mr. Chairman, Don, what page are you on?
Page
119,
120,
120.
children's services, and you'll see in the table there, you have the education non-statutory. That fund really doesn't exist. It should be Fund 9, School Foundation Program.
Motion carried. Second? Motion seconded by Senator Representative Larson. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 125, out of home place.
Before we do that, let's go ahead. So children's services as amended. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Go ahead, Don.
Mr. Chairman, the next unit for your consideration appears on page 125, out of home placements, children.
Out of home placement children,
That's right.
What was the page again?
125. So that's so if you're looking for us, so just so you're following along, there are several, we're just going to go back because some people there, just to go back for members that were missing yesterday. So what we're doing on these is we're going to these charts.
Yeah, the last
The
page.
last page. So there's a number so that so you're looking for in this unit, you're looking for if there's an exception request that you either want to change or if there's additional amendments you want to make other than
It's one time.
it's not a change, it's an exception request.
Yeah, it's just all my notes were on the prior pages, not the last page, so I'm struggling to keep up a little bit. So, Mr. Chairman.
It's okay, we'll take some time.
So, Mr. Chairman, we're on 125, which is the end of that unit 462. But on page 122, the governor denied the Children's Health Waiver and Care Management Entity. So we're going to do Gov's rec, and then we'll circle back later to the Gov's letter dealing with that matter. Is that correct?
We do that. If we can take care of it now, or if any governor's letters we have not dealt with, we'll deal with at the end.
So it'll be Gov rec on the denial, and then we'll re-examine the denial when we get to Gov's letters. I'm just asking how the flow works.
It can be either way you want it. If you want to
Yeah,
take
we
up.
do
the-
it.
Mr. Chairman, on the governor's letter, we put back in money on the mental health waiver and on the management entity program in unit 462. For 2953, 405 general funds and life and federal funds.
I mean, which page? You lost me.
This is on the gov's letter number 1, and it would be on
Page 122.
122 and 123 of the,
So, Mr. Chairman, if you look at your exceptions list or you go to page 122, the department, it was the governor denied elimination of the Children's Health Waiver and Care Management entity programs. He came back in Gov's letter number 1 and approved $2,953,405. Don, correct me if I'm wrong there. That's Gov's letter number 1 on that particular page. We might be better off just circling back on the Gov's letter rather than trying to clean it up here. I'll defer to the group, whatever's going to be cleanest.
So question, what's?
Go ahead, Representative Larson.
Mr. Chairman, what's your preference? Do you want to come back to the letter comes into 462 and then in 485 and a couple there? What is your preference? Just so
We'll
we
do it
don't
just like
call you out?
yesterday. We don't have to do it now, we will deal with the governor's letters, or if somebody's ready and they've already got that figured out and pulled it in, we'll take it now.
I make that motion, Mr. Chairman, that the governor denied it. I would like to accept the exception request on to the agency's recommendation.
Second. So, Mr. Chairman,
Go ahead.
the recommendation is in governor's letter that to support the maintenance of effort, that we fund this program, Unit 462, $2,953,405. And you'll find that in Gov's letter number 1, page 2, subparagraph 1.
And so, and just clarification, so that reference, is that reference to general funds? And then there's a like kind of matching federal funds, is that how I understand it?
Mr. Chairman, that is correct, but there is a significant distinction. The department's request is for new general funds, which was denied. The governor's letter was to use reverted funds. So if you want new money, you want to go with the agency's request. If you just want to use the reversions, then you use the gov's letter.
Governor's letter in
Okay,
this one.
all right. Is there further discussion?
Mr. Chairman,
Yes. So, and so let's just make sure, so with the motion, is the movement and the second agreed that it's the gov's, do you want to take on, it's just you want to approve the gov's act?
Correct.
Yes.
Okay.
Gov's letter.
So yes, Mr.
No.
Vice President.
I've got another question. Let's dispose of this.
Okay. Is there any other, are we clear on the motion? All those in favor of the recommendation, which is basically adoption of this portion of the governor's letter, say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman,
Mr. Vice President.
just the sequence that we're going through here, and I'm trying to correlate what we have with the exceptions requests is the way so is it in the intent to come back and deal with the exception request, or do we want to deal with those if we have a proposed amendment to those as we go through each one of those units?
Yes, we want to deal with the exception requests
Per unit.
per unit, just same like we did yesterday.
At the same time that we're going through it?
Yes. So this one's a little bit different if there was a governor's letter, and so we're dealing with governor's letter as we go through, but anything we don't get dealt with as we go through, we'll come back, we'll circle back and make sure we've considered them.
So,
All right.
Mr. Chairman, I'm with Senator Hicks, and I will catch on more quickly, but so Don goes to the end of the unit and he'll say
That's right.
page, 140, and I'm looking at an exception request on page 122. So I just need real careful signposting that we're on unit 462. So I know that
Okay, well,
that's where I need to go.
we'll add that, and we'll add that. So thank you. And we'll slow down just a little bit while we're going through Department of Health, while we get up to speed. So is there
Mr.
anything
Chairman,
else on?
along those lines, can we go back to unit 460?
Sure, let's go back, unit 460. Unit 460 is adult services.
Yep.
Okay,
Page 114.
page 114. Are you talking about priority request 6A or the Medicaid budget restoration?
Medicaid budget reduction restorations.
Okay.
Based on our current action in the whole unit, we've adopted that, correct?
Correct.
That's correct.
All right, Mr. Chairman, I just wanted to verify.
And Mr. Chairman, and I believe we adopted governor's rec, so we adopted the federal side, then we have that global motion of using reversions to cover the general fund side, because the governor denied the general fund side in lieu of that.
That's part of the
Right.
77.
Thank
All
you,
right.
Mr. Chairman.
Okay, clear. So we're we are back on, is there anything else in Unit 461, which is Children's Services? Go ahead, Don.
Mr. Chairman, there was a amendment. It's been some time, so folks may have not remember this, but on page 140 or 124, unit 0462, a member was interested in reducing the governor's recommendation by $100,000. Specifically, the rationale for this was the sentence that says, for the actual federal funds loss plus 100,000 for uncertainty.
Okay. Anything else? Anything else on, 462? Is that 461 or 460? That was S 462, right? We're on 462. Out of home placements. All right. So
Those as amended?
we have out of home. So we're out of home placements, unit 462 as amended. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 129. It's unit 0463, nursing facility services.
Nursing facility. Any other?
Mr. Chairman,
Go ahead. Representative Larson.
in unit 0463 and priority 8B, the agency made an exception request to increase nursing home cost coverage through Medicaid reimbursement. The governor denied that. It would be for $1.1 million. I move that we adopt the agency's request.
Second.
Mr. Chairman.
Okay, go ahead. Go ahead, Senator.
No, I thought he was calling for the question.
No, I was asking a question.
Oh, okay.
Sorry.
Go ahead.
Representative Larson, are you on 127 on that? Medicaid?
Yes, sir.
Okay, thank you. Just want to make sure I had the right one.
Mr. Chairman,
Go ahead.
on and against the motion, this increase is not required unless staff sets me straight. It's not required by any maintenance of effort. It was not something that the floor in the last session voted to put back for 1 year or otherwise. This is quite simply an increase in the rate, and I rise to oppose it. We're going to be right back in the soup in a few years ago, and I don't want to be increasing these things to just try and figure out how to cover it down the road.
Okay, thank you. Go ahead, Representative Larson.
So, Mr. Chairman, I hear my esteemed colleagues' thoughts, and for the most part, I agree with that, but I think that we see a change year to year. And one of the big concerns that we had last year is where will we be in the next fiscal year? As we've looked at our forecast, I know that we don't have a lot of room to play as we move forward, but our general fund, our anticipated revenue coming into our general fund have improved a little bit. Now, as we look back in these, what we call essential services for the citizens of the state, they're facing the same challenges that we are in hiring nurses, CNAs, and alike, and providing salaries. And so when we reimburse nursing homes on our Medicaid plan, we do it based, right now, we're at about 82%. And this is to increase the reimbursement rate from Medicaid to 83%. If we were to come up to 90%, it would be an additional $6 million of general funds. And so I thought that this was a reasonable approach to try and address the pressure that our skilled nursing facilities have around the state and bring it up to 83%.
All right, thank you. Other discussion? Ready for the question? All those in favor of the motion say aye.
Aye.
Those opposed, no.
No.
Let's see the show of hands. All those in favor, raise your hand. All those opposed, no. Motion carries. Thank you. Next item. Anything else in unit 463, nursing facility services? All those in favor of nursing facilities as amended, say aye.
Aye.
Those opposed, no. Motion carries. Next.
Mr. Chairman, the next unit for your consideration appears on page 132. It's unit 0464, hospice.
Healthcare financing, 0464. Excuse me, hospice.
That's right.
That's right. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Next.
Mr. Chairman, the next unit for your consideration appears on page 135, unit 0470, optional services, adults.
That's right.
That's right.
Mr. Chairman.
Go ahead, Senator Kinsky.
Excuse me, was it unit 045, 0485?
It's
470.
Excuse me, I'm sorry.
470.
Jumped the gun.
All right. Motion is Gus Rec. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 138. It's unit 0471, Indian Health Services.
That's right.
Gus Rec. All those in favor, Gus Rec, say aye.
Aye.
Those opposed, no. Motion carries on Indian Health Services 471. Don?
Mr. Chairman, the next unit for your consideration appears on page 140. It's unit 0472, Wyoming Life Resource Center.
That's right.
Gus Rec. All those in favor, say aye.
Aye.
Those opposed, no. Motion carries on unit 472.
Mr. Chairman, the next unit for your consideration appears on page 143. It is unit 0483, Long-Term Care Waiver Service.
That's right.
Gus Rec on unit 0483, long-term care. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 149, unit 0485, Comprehensive Waiver. There is a
Gov's letter.
correction here, I believe.
So are there any particular comments from any members who want you to bring this up, or is there a letter? Did
Mr.
anybody-
Chairman.
Gov letters on maintenance. of effort.
There's on page 145, the governor had a denial. And subsequently, we have a letter. So we'd want to accept that denial and accept his letter, which is one time for maintenance of effort, $10,218,036.
Is that your motion?
Yes.
Is there a second?
Second.
You got a second? Any further discussion?
And that will be as per governor's letter.
Yes, yes, this is motion is to adopt the governor's letter.
Mr. Chairman,
Mr. Vice President.
source of funding, or are these reversions, or where's the additional?
Revision.
Mr. Chairman, I believe it's out of the increased FMAP, isn't it, Don?
Reversions.
But the state portion is coming from reversion.
I see. Okay.
What's one time?
We'll just take a second and just confirm that. Is that correct?
Mr. Chairman, that is correct. The state's portion would come from the reversions pursuant to Governor's Letter number 1.
And we're also seeing the nodding of the mask director back there. So he concurs with you. Anyway,
Mr. Chairman, I just want to make sure, each one of these, as we go through and fund out of reversions, do we need to specify in each one of these categories then that this is one-time funding?
Mr. Chairman, Gov's letter specifically calls out one time.
Okay, that's what I want to make sure.
Okay.
Thank you, Mr. Chairman.
Mr.
All right.
Chairman,
go ahead.
in the same unit 485,
What's up?
members will recall that during the budget presentation, we asked the department about a step 2 reduction that was for that we restored last year, and it was a maintenance of effort for services as well. And it inadvertently did not get put in the budget, but it's included in the governor's letter to restore one time step 2 reduction for Medicaid budget for the comprehensive waiver in the amount of $967,450,000 and a like amount from federal funds. And so this would be adopting the governor's letter.
The full.
Should we dispose of the first motion?
I think that we're still on that.
I thought we did that.
No, we hadn't voted on it yet.
I apologize.
I thought you were expanding on the motion. So back on the motion, which is adoption of the Gov's letter, Gov's rec, or excuse me, the governor's letter. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Letter's adopted. Now, Senator Larson.
Motion as I bloviated on, Mr. Chairman.
I'm not sure what how's your motion different than what we just did?
This is the remaining component.
This is the third component of the governor's letter. There was three components of the letter, one in unit 462, which we disposed of, the one that we just did, which is in 485. And then this is the final one, which is also in 485 for restoring the step 2. And we had requested the agency to make this part of this year's request as well. And it's for the home services, the community home service stuff that we done, and so this would restore that.
Same with reversions one time.
Reversions one time.
So moved.
Question?
All right, question. All of you, everybody understand the question? All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, I believe you are still on unit 0485 as amended.
Thank you. Anything else on unit 485 as amended? All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 152. It is unit 0486 support services waiver.
That's right.
Thank you. No, and there are no exception requests on this one. Govzrek, all those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 158. It is unit 501, Public Health Division Administration.
That's right.
Govzrek, all those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 162. It's unit 502, Public Health Preparedness.
That's right.
Govzrek, any on unit 502? All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 167, unit 503, Emergency Medical Services and Hospital Preparedness.
That's right.
All those in favor of Govzrek on unit 503, emergency medical services and hospital preparedness, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 172, unit 510, Rural and Frontier Health.
That's right.
All those in favor of Govzrek on unit 510, Rural Frontier Health, say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 176, unit 522, immunization.
That's right.
Unit 522, immunization. All those in favor, Govzrek, say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 182, unit 523, maternal and child services.
That's right.
Govzrek on unit 523, maternal and child services, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 185. It's unit 524, nurse home visitation.
Unit 524, nurse home visitation.
That's
All
right.
those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 189, unit 525, women, infants, and children.
That's right.
Unit 525, women, infants, and children. All those in favor say aye.
Aye.
All opposed, no. Motion carries. I'm glad you're in favor of women, infants, and children. Don?
Mr. Chairman, the next unit for your consideration appears on page 195. It is unit 526, public health nursing.
That's right.
All those in favor of unit 525, public health nursing, say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 200, unit 531, cancer screening.
That's right.
Gabriel Govzrek on unit 531, cancer screening. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 205. It's unit 532, public health laboratory.
That's right.
Unit Govzrek on unit 532, public health laboratory. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 210, unit 534, communicable disease.
That's right.
I'm not saying this one out loud. Unit 534, all of Govzrek. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 213, unit 538, chronic disease epidemiology and surveillance.
That's right.
Govzrek on unit 538, chronic disease epidemiology and surveillance. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 218, unit 539, injury and chronic disease prevention.
That's right.
Govzrek 539, injury and chronic disease prevention. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 222, unit 540, infectious disease epidemiology.
That's right.
Unit 540, Govzrek infectious disease epidemiology. All those in favor say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 227. It's unit 550, substance abuse and tobacco prevention.
That's right.
Unit 5 Govs Rec, Unit 550, substance abuse and tobacco prevention. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 229, Unit 585, the WIC ARP CVVB.
Easy for you to say. Unit 585. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Next.
Mr. Chairman, the next unit is the first in the Behavioral Health Division. It appears on page 236, Unit 2501, Behavioral Health Administration.
Govs Rec.
Govs Rec 2501, Behavioral Health Administration. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 240, Unit 2502, Recovery Supports.
Govs Rec.
Govs Rec 2502, Recovery Supports. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 245, Unit 2503, Court Supervised Treatment.
Govs Rec.
Govs Rec Unit 2503, Court Supervised Treatment. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 253, Unit 2505, Wyoming State Hospital.
Govs Rec.
Govs Rec Unit 2505, Wyoming State Hospital. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 257, Unit 2506, Outpatient Mental Health. And there were some interest in amending on this, if anyone, there is no exception request, but there was an interest, I believe, in amending it.
It's myself. There you go.
Representative Larson.
I think Senator Kinski had a thought
On this unit,
Mr. Chairman, Representative Larson and I, in our discussions with the Department of Health, are concerned about these residential and community mental health centers. There have been some payment changes combined with the cuts over the last 4 to 6 years that there's a concern about sustainability, at least until the department is able to put together a whole new reimbursement methodology. And we think we're about 2 years, at least a biennium out from that. So in our conversations with the department, it was to restore these Part 3 cuts and do it on a one-time basis, pending the department coming back with the payment reform methodology. So in this particular unit, it would be, I think it's adopt and further amend $7,249,086.
Second.
Increase.
yes,
Source of the fund.
second,
And is it a general fund or is it?
it is
Harper, or where are you coming?
Representative Larson, where did you want the money to come from?
general funds.
Additional money. All right. Any discussion? So that's a motion and a second. I take it that's your motion, and Senator Larson, or Representative Larson, is your second. For the discussion, those in favor of the motion, say aye.
Aye.
Those opposed, no. Motion carries. Back on Unit 2506 as amended. Any further amendments? All those in favor, say aye.
Aye.
All those opposed, as amended. Excuse me, let's do that again. All as amended, Unit 2506. All those in favor, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman,
Go ahead, Kevin.
Don, correct me if I'm wrong, but this unit is 100% generally funded,
Yes.
and we could use ARPA Direct on it and help us with our conversion.
Okay.
I'd move to modify to make it ARPA Direct.
So basically, I think we've already captured the most of this, but the 7.2 we'd add to that.
All right. Is that okay?
Yes, Mr. Chairman, basically what Kevin is describing is using less Y.FMR money and more direct general funds for the conversion. It helps us in a number of ways.
So be it. I move we so do it.
I think you've already moved it. So the second, everybody understand? Go ahead, Don.
Apologies, Mr. Chairman, but this comes up. Is this a one-time or an ongoing?
One time, we're pending, we're waiting for the department to come back with their reimbursement methodology change.
You shall come back.
I'll be back. All right. So I think we've got that taken care of on the fund change. That's approved. So again, back on unit 2507 as amended, as a further amendment.
06.
106, 2506.
2506, thank you. On 2506, as further amended. Those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 260. It's unit 2507, outpatient substance abuse. I believe there is an amendment.
Mr. Chairman, I move governor's rec and further amend to increase by $1,311,816 one time from ARPA Direct.
Second.
Second, please explain.
So to clarify, the community mental health and the substance abuse, community mental health and substance abuse, both community mental health and residential. We don't actually call those out anywhere per se, but we fund outpatient mental health, outpatient substance abuse, residential mental health, and residential substance abuse. So this is how we're directing those dollars to the community health programs. And the next two, we will direct the dollars to the residential mental health and substance abuse programs.
So, Mr. Chairman, as we go through them, this mental health section, we're restoring those funds per unit as they were taken out. So it's kind of it'll be over 2 or 3 units.
And what's your source of funds?
ARPA Direct, one time,
And one time.
And Mr. Chairman, what was that dollar amount, please?
$1,311,816.
Don?
Mr. Chairman, just for clarification, that is ARPA conversion dollars,
Yeah.
not ARPA direct dollars.
Oh, I'm sorry,
Yes.
Mr. Chairman. I thought he said ARPA Direct. I thought Kevin said ARPA Direct in the prior
Conversion.
conversation.
Kevin?
Mr. Chairman, I did. In the prior conversation, there is no federal fund entanglement, so we can use ARPA Direct. And then we'd be able to have that to help us with the general fund assistance. In this case, mathematically, I think it's okay because we only have like $1.3 million of federal funds. The lion's share of it's general funds and tobacco funds, but still using ARPA Direct with federal funds creates entanglements we want to avoid. So if you'd like to use ARPA revenue assistance, then that'd be okay, or direct general funds.
Okay, are we clear? That's the motion.
Mr. Chairman,
Or
Mr. Chairman,
we
Mr.
have some
Chairman,
confusion. We'll go to Senator Drew and then we'll come down to you, Representative Smith.
I just want to make sure I thought we were keeping those ARPA Direct dollars separate, but here we're just inserting that and that's
Okay.
okay.
So
Just general comment.
this is, yeah, so ultimately, there's not really much difference between general fund and
Okay,
ARPA,
so make sure.
revenue replacement. Go ahead.
Mr. Chairman, I think I'm asking the same question, just kind of give a running tally of how we're affecting the general fund. The prior 7.2 million, that's just ARPA funds, doesn't affect the general fund because we're doing a swap. This one, 1.3 million, is different and is effectively adding to our general fund expenditures. Is that correct?
Don?
Mr. Chairman, I think they're both the same. I think both of them are ARPA funds. The funds would be from ARPA. However, it would be to conserve general funds, that middle row, as opposed to what I term as ARPA Direct, meaning ARPA with no conversion of general funds.
Be conserved.
So most of us in appropriations have kind of just adopted the idea that the conserved general funds and general funds are not a lot of difference between those. And so anyway, did you catch, it was in Kevin's explanation.
So
And he needs to repeat.
Mr. Chairman, if I'm,
That's the difference.
I had thought that what's happening is that Mr. Hibbard had identified the opportunity to use ARPA funds to do another swap essentially. Is that happening in both categories here?
And then I think the answer is no. He was concerned about the entanglement that this created because there are some matching federal funds in this one. And Kevin, if I misspoke, please correct.
Mr. Chairman, that is correct. And Don and I just had a quick sidebar. I was using ARPA Direct as being ARPA out of the funds that we have that are available for appropriation out of the ARPA that have to be qualified with ARPA.
Mhm.
And I was calling that ARPA Direct. I think what Don and I want to call that now is just say it's ARPA. When it's coming out of the pot of money that's available, it has to be ARPA qualified. And then revenue assistance, Don, we want to call or general fund conservation is the other pot. So in the prior one, it's okay to use ARPA on it because there was no federal funds. In this one, there's federal fund entanglements. But that doesn't preclude you from using general fund conservation.
So, Mr. Chairman,
Yes,
Kevin used the phrase revenue assistance. Is that the same as conserve general fund?
yes.
Mr. Chairman, that has been
Okay.
the same.
Our nomenclatures, we got, try and keep straight on the nomenclature. So anyway, yes, Don.
Sorry, Mr. Chairman. So this unit would come out of conserved general funds because of the entanglements.
That's the way I understand it,
We want to avoid entanglements.
especially foreign, I mean, federal entanglements, but anyway, yeah, imperial entanglements. So did we vote on this? Or is this?
No.
Okay, so
As
everybody
amended.
understand the motion as now amended? So the motion. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Anything else on unit 2507, Don?
Mr. Chairman, yes, I believe there is a request for a footnote here to make the $7.5 million in tobacco funds effective immediate.
Okay. Is that a motion? Is that,
So moved. Second.
you can't move and second.
Well, I heard it.
That's
Bob lets me.
we can make that rule, save time. Okay, motion been seconded by Senator Giroux. For discussion, all those in favor say aye.
Aye.
Those opposed, no. Motion carries. Back on unit 2507. Anything else on 2507? Oh, 2507 as amended. All those in favor say aye.
Aye.
Those opposed, no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 263, unit 2508, residential mental health. I believe there is an amendment.
Mr. Chairman,
Go ahead, Senator Kinsey.
I'd move governor's rec and further adopt to increase from one-time ARPA Direct, $2,664,702.
Okay, thank you. Discussion? Discussion. All those in favor of this motion, which is using ARPA conserve, I guess,
ARPA Direct.
ARPA direct. So just flat ARPA, straight ARPA. All those in favor?
Mr. Chairman,
Go ahead.
may I suggest?
We consult with staff and make sure ARPA Direct, or does this need to be, which fund should this come out of before we?
This unit looks like it's entirely general funded, so it can come out of ARPA direct,
Mr. Chairman, that's correct.
Okay.
or ARPA. Okay. We're all on the same page? All those in favor of the motion, say aye.
Aye.
Those opposed, no. Motion carries. We're back on unit 2508 as amended. Any further discussion or amendments? All those in favor of 2508 as amended, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 266, unit 2509, residential substance abuse. I believe there's an amendment.
Okay. go
Mr.
ahead.
Chairman, I would move governor's rec and further amend to increase by one-time ARPA revenue replacement, $3,967,864.
Is there a second?
Second, sorry, it's sleeping here.
Okay.
Explanation, please.
So, Mr. Chairman, again, there's two components of the community and residential mental health. Or four, actually. It comes in federal funding that is divided into, without mentioning community mental health centers or residential treatment centers, outpatient mental health, which is 100% state, or excuse me, is partially, which one's partially federal?
Residential.
Well, I think it's mental health is partially, is fully general fund, right? And substance abuse is partially federal fund. And the mental health component, again, comes instead of just funding the facilities and the programs as residential mental health 2508 and now 2509 residential substance abuse. And this one is revenue replacement because there is federal funding.
Okay. Don, did you have something?
Mr. Chairman, all I concur with, it is actually general funds that have been conserved.
Okay, thank you. All those in favor stand the motion. Further discussion? All those in favor of the motion, say aye.
Aye.
All those opposed, no. Motion carries. We're back on 2509. Anything else on 2509? All those in favor of 2509 as amended, say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 274, Unit 2510, Preschool Services.
Mr. Chairman,
Mr. Vice President.
could we go through this one on each exception request separately?
Sure. All right, Don, why don't you take us through the exception requests for this unit? So we start on 267. Well, that's not the first exception unit, but
Yes, Mr. Chairman, the first exception request, I believe, appears on page 269. It is a request for $4.4 rounded $1 million out of the school foundation program. This is to assist in the maintenance of financial support. The governor's recommendation is in the affirmative, and this continues the funding source used last biennium.
Well, Mr. Chairman, on this is 100% school foundation program funds, correct? Would this be eligible for ARPA direct?
let the brain.
Mr.
trust.
Chairman, I don't believe so, as the purpose is to maintain our federal financial support, and we would run into the issue of federal matching federal.
Well, Mr. Chairman, a follow up with that, I suppose it would be the same answer if we were using ESSER 3 funds through the funds that was eligible for the WDA to their portion of that ESSER 3 funds. Would be the same scenario.
Mr. Chairman, Senator Hicks, I think it's a similar scenario, federal matching federal. And in addition, they have a letter from the Federal Department of Education indicating that state legislatures are not allowed to appropriate the ESSER funds.
Okay, thank you, Mr. Chairman.
Thank you. Continue, Don.
Gov's rec.
Well, so anything, that's the only question you had on that particular. unit?
No, but if we can dispose of this one and move to the next one.
Let's just, the Gov's record will be already in the motion. Go ahead.
Thank you. And this also applies to us 0461, which is Children's Services. And just a comment, because we're using school foundation money here. And from what I understand of both these programs, part of it is educational and part of it is actually medical. I'm not objecting, but at some point we need to have that conversation of appropriate use of school foundation money.
Okay, thank you. Dawn, do you want to continue to go through the exception request?
What's that, Mr.
Did you want to go, did you want Dawn to continue through the other exception requests?
Yeah, but I think if we can just dispose of the ones as we go through it, rather than try to do it global. So, Mr. Chairman, on this one, I would go ahead and make a motion to adopt governor's rec on priority number 7C, part B, 619, maintenance of financial support.
Without, we can do that, but that'll be in the motion at the end. I mean, 'cause the motion is Gov's rec. So you're,
All right,
okay.
Mr.
So,
Chairman, on to priority number 11.
yeah, so go on to priority number, go to the next priority. Now.
Mr. Chairman, priority number 11 is the preschool ECA or external cost adjustment. The governor supports $1.1 million. That amount is for the current year. Staff would suggest if it is indeed for the current year, which is what he is suggesting, it likely needs to be effective immediate. And then he denied the remaining amount. The department then submitted in December their child counts, and there was an actual decline in the number of, excuse me, that's the next one related to child counts. This is just the ECA. So this does not need to be effective immediate. It's 1.1 million.
So I have a question on that one. on is this at the end of, is this to match what the ECA is that's going to the rest of the ECA for K-12? Is that to kind of keep these in the same place? Not exactly, but essentially.
And Mr. Co-Chair. So my understanding is on this in the past, we've denied it because it creates a maintenance of efforts. The minute we do it, we're locked into it. And so that's my understanding.
Mr. Chairman, that's correct too. So statutorily, the department has to ask for the backlog plus the current year. So the governor's recommended just the current year. But it does have expectation, once you get there, once you're at that threshold, you have to stay.
Okay, thank you.
Mr. Chairman,
Go ahead, Senator.
we've been puzzling over this table that's on page 270 and the difference between 9-point-something million and the 1 million that the governor approved. And I wonder if Stefan might walk us through that. I know we touched on it during the regular presentation, but we've had some members that have, and I'd like some clarification on it.
Thank you. Go ahead. Director Johansen, go ahead.
Mr. Chairman, members of the committee, Stefan Johansen, Interim Director for the Department of Health. That table that Senator Kinski you referenced, it shows all of the, as Kevin put it, the backlog of ECA requests that the department is required to bring every year to this committee. And it also shows you out of those requests going back numerous years, which ones you all have recommended or funded and at what amount. So it just kind of shows you the history. As Director Hibbert also mentioned, our request this year for the external cost adjustment in the preschools includes all of the backlog, again, per statutory direction. The governor has recommended just the current year. So that table will show you in previous years what the legislature has ultimately funded out of those ECAs. And you'll see that some years it's been zero, some years it's been some of those ECA numbers have been funded.
Thank you, Stefan.
Mr. Chairman. And then Stefan, you guys tell me what the health of the institutions is. Some years they get it, some years they don't. Give me an idea of how these folks are doing.
Mr. Chairman, Senator Kinski, that's a good question and a big question. It varies. We do have a little bit of data lagged Form 990 nonprofit cost reports for the child development centers for the preschools. We can send that to the committee. It's published on a website where you can see the overall health compared to their national peers. But it is a bit of a mixed bag, as most of our providers in Wyoming are, where some are in better financial position based on cash on hand, other indicators, and some are on a little bit thinner margins. I will mention these are all nonprofit centers. So they do operate a little bit different than a for-profit business when you look at their cash flow, when you look at their profit margins, but happy to send that to the committee. I think from my personal opinion, if the current year ECA was funded, our child development centers would be in decent financial shape en masse or on balance statewide.
Mr. Chairman,
Representative Stitt.
for Mr. Johansen, and I should have asked this perhaps in December, but on page 270, similar question. What is, if the governor's recommendation is adopted, what will then the per child amount be approximately?
Mr. Chairman, Representative Stith, I don't have the exact number in front of me. I know that's been calculated since the December 1st count, and happy to provide that to you. My understanding is that it's just over $10,000 per child if you average between Part B and Part C. So I think it would come out roughly similar. But as you indicated, and the committee discussed before, our child count as of December 1st did go down between Part B and Part C on balance by about 220 children. So that exception request for the enhanced or increased child count is no longer needed.
Okay,
Mr.
thank you.
Chairman.
Yes.
So,
go ahead,
so
Mr.
follow up on that, Stefan. Is that using the 2019 child count, or is that year over year? Given the statutory language, last year we used the 2019 count. So is when you talk about reduction, is that a year over year, or is that from 2019?
Mr. Chairman, Senator Hicks, this year's child count is as of December 1st of 2021. So the most recent count that was made. So they are current numbers. And you're right, last year, due to a request made by the centers and discussion with this committee, and because of COVID-19 issues related to having the appropriate assessments done in every community and the challenges with that, the legislature did authorize the use last year of the previous year's count. That did not carry forward this year.
All right, Mr. Chairman, another one, just for clarifications. My understanding, this is not required for an MOE. This ECA as it's currently structured. Is that correct?
Mr. Chairman, Senator Hicks, that is correct in terms of the external cost adjustment request.
All right. Thank you.
Okay,
Mr.
thank
Chairman.
you.
And Mr. Chairman, just one more, and you don't, if you can answer it, that'd be fine, but it'd be a follow-up memo. When you said some are struggling and some are doing well, is there a division between rural and urban there? Are the ones in the larger towns doing okay and it's the rural ones that are struggling?
Mr. Chairman, Senator Kinski, I would struggle to answer that off the top of my head. We'll look
Okay.
into the most recent financials we
All right.
have and try to provide a summary.
Thank you.
All right, thank you.
Mr. Chairman, one other question. Again, this is 100% state funded with the ECA. Is this something that we could look at ARPA dollars to fund?
No, I don't not believe so. This is actually used to facilitate federal dollars in other places.
All right, thank you.
Okay, thank you. All right.
Say it again. I'm sorry, Mr. Chairman. This is actually used to facilitate federal dollars in other places. What's that mean?
Mr. Chairman, if I could restate Kevin's, the general fund is necessary in order to achieve the federal match. So if we use ARP funds, we will not receive a federal match. And a great example of that is priority number 15, where there is $5.4 million of federal funds. If the state funds aren't expended, the federal funds would be in jeopardy.
Thank you.
All right, thank you. Is there any other questions or other discussion? So we're back at unit 2510. I have not heard an amendment to change that. So the motion still is GovRec.
Mr. Chairman,
Yes.
I would move that we reduce the governor's recommendation here by, let me see, $1,098,275.
Okay. We got a motion and a second. Further discussion?
Mr. Chairman,
Go ahead, Senator.
I'm trying to follow. You only asked for $529,000.
I did.
No. You go to, if you look at page 271, he recommends approval of the current amount, $1,098,275,000.
Oh, I'm looking at the enrollment. Sorry. Second.
Okay, so it's been thirded. Anyway, all those in, is there further discussion? All those in favor say aye.
Aye.
Those opposed, no. Show, all those in favor, raise your hands. All those opposed, raise your hands. The motion carries.
What was the final count?
It was like, I saw 3 down there.
Opposed?
Opposed. And how many were opposed? Oh, I didn't see. So yeah, 4. Okay, 4. I didn't see Mark. Excuse me. Representative Kennedy. Motion passes. So we're back on 2510 as amended. Any other discussion, any other amendments? All those in favor say aye.
Aye.
Those opposed say no. Motion carries. Don?
Mr. Chairman, the next unit for your consideration appears on page 284, Wyoming Life Resource Center. It's unit 2512. And I believe there is a request for a technical correction on revenue code 6610R, should in fact be T3.
Okay, is there a motion?
So moved.
Mr. Chairman, on page 284, you can see that permanent land fund budget hue. This actually should come out of a permanent land fund for the state hospital, which is designated as T3.
So you to P3. Got a motion? Got a motion, a second. All those in favor say aye.
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 Those opposed, no. Motion carries. on 2512 as amended. That rec as amended. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 293. It is Unit 5001 Administration.
Goes right.
Gov's rec on unit 5001 administration. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 299, Unit 5002 Senior Care. We do have several items to address here. If you adopt the governor's recommendation, then $2,749,894 for the WISE program, WYHIS program, should be effective immediate.
Mr. Chairman, I'm sorry, I had a sidebar. Are we on unit?
We're on unit 5002. Senior care.
Mr. Chairman?
Yes.
And we are on which of the first, we are on the first of the exception requests, is that correct?
We are not in any specific exception request.
Okay.
So motion is Gov's rec. Are there any changes?
Yeah, Mr. Chairman,
Go ahead.
I would move with respect to exception request on page 295 that we deny Gov's rec pending discussions with the Department of Health on modifications to the program with regard to means testing and outcomes measurement and possible federal demonstration project.
Okay, is there a second? And a motion and a second. Further discussion?
So I believe on that motion that we wanted, whatever we do, it was a time limited component on it.
Complete denial, or was it 1 year?
1 year.
Okay, so it was, go ahead, Representative Larson. Help us.
Can we clarify the proposed amendment again?
Mr. Chairman, it's, the motion is on the exception request on page 295, 296 to deny Gov's rec for 1 year. Pending discussions with the Department of Health on program changes with regard to means testing, outcomes measurement, and demonstration project for possible federal funding. So I guess it's deny and partially approved because we're approving.
Mr. Chairman, may I make a friendly amendment and say that we reduce the amount by half and make it for the first year of the biennium with the requirements he makes, and then the second half would have to come back as a request in the supplemental budget.
Adopt that as a friendly amendment.
Okay,
Mr. Chairman,
yes, go ahead.
well, I would certainly support that because I think this is really an important program. And I think we can certainly make improvements. And I think the folks that work with this have indicated that they're willing to do that. And especially in the means testing area and the possibility of a 1115 waiver. So I would certainly encourage our support here.
Thank you.
So, Mr.
Go ahead, Mr. Co-Chair.
I think the crucial part of this is we want to make this program federally compliant to get matching dollars. And we would like the Department of Health to assist us in doing that and making a guidelines for what we have to do, how we have to do it, and when we can do it so that so we're there.
So, Mr. Chairman, that'll be a follow-up amendment request for a footnote to accomplish.
Oh, he's asking you to trust him. So we're on the amendment. Go ahead, Representative Schwartz.
Thank you, Mr. Chair. And while I'm in support of looking into how we can improve this program and hopefully get it a waiver, I think in order to create stability, we should fund it for the entire biennium. So I will be opposed to this amendment.
Okay, thank you. Any others? Any other comment? Are we ready for the motion? All those in favor of the motion, say aye.
Aye.
All those opposed, no.
No.
Motion carries.
Mr. Chairman.
Go ahead, Representative Larson.
So, Mr. Chairman, I would make a motion that we direct the Department of Health, and I think that there may be some language, I submitted some language to Dawn that is acceptable to the Department of Health, where they might, where we would direct the Department of Health to enter into conversation with CMS to consider an 1115 or other waivers and look at eligibility, deliverables, and things to make this program conform statewide and be eligible for federal funds.
Mr. Chairman,
Go ahead.
I second that, but I wonder if you would accept as a friendly amendment, whether if they determine they cannot become eligible for federal funds, they still need to make the program more robust with respect to means testing and have an outcomes measurement component, whether they get the federal funding or not. If it looks like the federal funding is a bust, they still need to do those things to make the program more rigorous.
Friendly.
Better friendly amendment? All right, thank you. Any other discussion? Ready for the question? All those in favor of the proposed budget amendment, say aye.
Aye.
Those opposed, no. Motion carries. Go, Ms. Vice President.
Priority number 6C. I would move that we amend that and remove the 100% general fund and substitute the reversions from the agency's budget.
Mr. Chairman, before I second, I've got a question for Dawn, perhaps for Stefan. I thought the department already made this up for the balance of the biennium out of other funding. I thought they'd be 11 or something to cover this.
Okay, I'm going to take that comment as a second so we can discuss this. Go ahead,
Okay.
Director.
Mr. Chairman, Senator Hicks and Senator Kinski, we are in the red in this unit, covering the $2.7 million that's part of request 6C. Whether we can cover that with reversions or not, as we discussed earlier, currently the $76 million of department reversions we project now are obligated to be spent between what's in the budget book, what's in the governor's letter, and the actions that have been taken with our reversions. As we've told the committee, we will update you all on what our reversion projections look like this month, next month, going forward. They could go up or down. We can certainly, Senator Hicks, do that to the extent that we have supplemental budget requests next year. If our reversions aren't able to cover some of these areas, would be where the risk is. But with the Wyoming Home Services Program, I think the intent of the legislature last session was to fund at least partially, if not for the full biennium in 21-22, the Home Services Program. Ultimately, the budget bill didn't shake out that way. So we covered the $2.7 million request that you see here out of general funds that the department won't have outside of those reversions, again, which are obligated, if that makes sense.
Mr. Chairman,
Thank you. Go ahead, Representative.
Mr. Chairman, just so I understand the motion, if adopted, essentially that reduces the general fund by $2.7 million, right?
Yes, go ahead, Representative Schwartz.
Thank you. I just need clarification as well. Are we on 6B as in boy or 6C as in Charlie?
C,
Thank you.
cat.
Meow.
As in yes. Mr. Chairman,
Yes, go
just
ahead.
follow up for Stefan. You're obligated to make the payment. What I heard is that you said you'd have to cover it with general funds you don't have, but you've actually found something somewhere in your budget to cover this 2.7.
Mr. Chairman, Senator Kinski, we're actually just covering it out of basically carrying it. Right now, our finances in the Department of Health, because of CARES Act, because of enhanced match, do look good. That's where that $76 million of reversions come from. To the extent that the legislature, with the governor's budget and the governor's letter, obligates those potential reversions, our ability to cover reduces. So in a world or in a biennium where we didn't have all of these projected reversions, so hypothetically, if we didn't have the 76 million, this would be a need to essentially have $2.7 million of general funds effective immediately to cover the budget shortfall in Wyoming Home Services that was created last year for the current 21-22 biennium. Again, I'm not trying to be dodgy here, but the more we obligate in projected reversions, which could go up between now and June 30th, but they also could go down, potentially the less chance we have to cover all of these obligations with those reversions, resulting in us coming back to this committee, coming back to the governor, and ultimately this committee in the supplemental session saying we weren't able to cover these obligations. We will do the best we can with what's in the budget book, with what's in the governor's letters, if something's added here for home services to cover that. But just want the committee to know that could result in supplemental requests.
Mr. Chairman, if I may.
Go ahead.
Would it be better to just allow you guys the discretionary ability to go B11 or find any other funding in your budget to be able to fund the 2.7 versus just saying it has to come out of reversions?
He does have, you do have superflex already.
Mr. Chairman, Senator Hicks, that's correct. I think that we could receive that direction. That's essentially what we would do anyways.
Okay,
All right, Mr. Chairman, I would amend my motion
okay, go ahead.
to just reduce the general fund appropriation by $2,749,894.
Okay. And are you still seconding?
Yeah.
Okay, so motion and a second. Any further discussion? All those in favor of the motion say aye.
Aye.
Those opposed, no.
No.
That sounds like that motion failed.
Oh, you better show hands.
What's that?
Show hands.
All right, we'll call, as the division having been called for, all those in favor of the motion, raise your hand. Those opposed, say no. 1, 2, 3, 4. That's 5. 5. Motion passes. Okay. Thank you. Anything else on unit 5002 senior care? Anything else on 5002 senior care? All right, on 5002 senior care as amended, all those in favor say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 303. It's unit 5003 nutritional services.
Gov's rec on 5003 nutritional services. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 307, unit 5004, Title 8, Elder Rights.
That's right.
Gov's rec on unit 5004. All those in favor say aye.
Aye.
Opposed, say no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 310, unit 5005, Senior Volunteer Service Program.
That's right.
Gov's rec on using 5005 Senior Volunteer Service Program. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 312, unit 5007, Wyoming Senior Services Board.
That's right.
Gov's rec, unit 5007 Senior Services Board. All those in favor say aye.
Aye.
Those opposed say no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 316, unit 5010, Healthcare Licensing and Surveys.
That's right.
Gov's rec, unit 510 Healthcare Licensing Surveys. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 321, unit 5040, Pioneer Home.
That's right.
Gov's rec, unit 540 Pioneer Home. All those in favor say aye.
Aye.
Those opposed say no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 328, unit 5050, Veterans Home, and I believe there is a request. Yes, during the agency's testimony, the director, I believe, made a request to, if you approve the $4,975,651.35 FTE, to make that effective immediate general funds.
So moved.
Motion and a second. So I think is this on exception? Is this for an exception request 4? to make that effective immediately? No. I got a one head nod, but we'll let our, the brain trust confer.
Mr. Chairman, I think it's priority number one.
One.
Mr. Chairman. Yes, priority, yes, the nursing, maybe I misspoke, but it's the nursing staff. It's putting the staff in the new construction. So you got to staff it or you can't use it.
Mr. Chair, yeah, but I get, the number I heard does not correspond to what I see on page 325.
Mr. Chairman, correct. Apologies. It is in error. The number is 5,148,724.
Thank you.
Okay, go ahead. Representative Drew. I think that was just a technical correction. The motion was on the just rec. I think we're going ahead and making it effective immediately. So anything else? Anything else? On the motion, all those in favor say aye.
Aye.
All those opposed, no. Motion carries. Anything else on Unit 550?
Did we discuss the source of these funds?
Mr. Chairman, I think this is in the initial document where it says that these funds would be approved as general funds, but are to be used as last resort. They should be covered by
Reversions first. But they, and then if there's not enough reversions, then there's this general fund appropriation to cover that amount.
Anything else? All right, so again, on Unit 550, as amended, Veterans Home, all those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 338, Unit 5060, Retirement Center.
Unit 5060, Retirement Center. All those in, motion is Gus Rec. All those in favor say aye. Those opposed, no. Motion carries. That's it.
Step 3 reduction.
Anything else on Agency
I
46?
didn't want to do it.
Motion to close. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, is this a good time for a break?
Didn't start till 9, but okay. Take 10 minutes. Thank you. We'll stand in recess for 10 minutes. consideration is Department of Family Services, Department 49, I believe. So, Don?
Mr. Chairman, the first unit for your consideration appears on page 19. It is Unit 5701, Energy Assistance and Weatherization.
Energy Assistance, motion is Gov's rec on Unit 5701. Energy Assistance and Weatherization. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 26, Unit 5801, Boys School.
Motion is Gov's rec 5801, Boys School. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 32, Unit 5802, Girls School.
Motion is Gov's rec Unit 5802, Girls School Sheridan. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 46, Unit 5901, Administration and Support.
Gov's rec Unit 5901, Administration and Support. All those in favor say aye.
Aye.
Those opposed, no. All, motion carries.
Mr. Chairman, the next unit for your consideration appears on page 51, Unit 5902, Protective Services.
Unit Gov's rec on 5902, Protective Services. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 54, Unit 5903, Community Crisis Beds.
Unit 5903, Community Crisis Bids. All those, Gov's rec, all those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 63, Unit 5904, Protective Services and Juvenile Justice.
Sounds right.
Gov's rec on Unit 5904, Protective Services and Juvenile Justice. All those in favor say aye.
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 Oh, man. I'm afraid all those in favor say no. Motion passes, but barely.
Mr. Chairman?
Yes,
I'll find out in just a second, please.
sure. Brief timeout. Catch up.
Catch-up timeout.
Mustard time.
Yeah.
It's always awesome.
So, okay, so Mr. Chairman, the question is if I may, is on page 53 where the department asked for an infusion of $1 million of ARPA funds to be used to replace the money that didn't come in from federal match because there wasn't services provided. Thanks to Representative Walters, he points out that those are ARPA dollars, but do we need to make receipt of those effective immediately here? Or do we do that in the budget or in the ARPA request? We're just trying to make sure we have it covered.
So, so as I understand your question, so we're backed up. We're back in Unit 5903, Community Crisis Beds.
Correct.
And you're trying to make sure that of the $1 million that was approved, that was two things. One, it was the Gov's rec was ARPA revenue assistance, which was just that we're calling it conserved ARPA or.
Mr. Chairman.
Go
yes,
ahead, Kevin.
This would be the conservation of general funds, and accepting the governor's rec here would facilitate the usage of those dollars.
And
I'm not confident that it is in the governor's proposals for ARPA. So I think you need to
The
address.
question is it effective immediately?
Yes, Mr. Chairman, that's fine.
okay, so
Mr. Chairman, could we ask the director of the agency to make sure that effective immediate is what is desired here?
okay, there you are. Corin, how are you?
Mr. Chairman, I'm doing well, thanks.
Welcome, Director. Did you hear the question?
Yes, sir, I did, and thank you. Corin Schmidt, Director of the Department of Family Services. Yes, we would like these monies appropriated immediately. It is for a shortfall in the current biennium.
Okay. So, Mr.
Mr.
Let's
Chairman?
go back. We're going to reopen, we're back on Unit 5903.
Move to reopen 5903.
It was ever closed, so just make your motion. Just
Okay.
back on 5903.
Very good. Mr. Chairman, I would move to make $1 million for crisis beds effective immediate.
So the gov, we've already approved the money, so this is just, the motion is to make it effective immediately. And this is in reference to specifically priority 6, is that, as I understand it? And that's the money that's effective immediately, not the entire unit money. Okay, so go ahead. Don, did you have something?
Mr. Chairman, I do, just to be clear here, there is no money in this gov's rec, but it does appear in Governor's Letter number 17. So you're picking out that component, one of about 40 components in Governor's Letter 17, approving that with this motion and making it effective immediately.
Okay, that's what it does. So are we clear on the motion? Is there discussion on the motion?
Discussion,
President.
so do we need to put any other further restrictions on this, that it can only be used for emergency beds for the biennium, or I'm just worried if we don't need the money and all of a sudden, could this be B11 to some other area?
So, Mr. Chairman, I believe the issue is that's not for this coming biennium, it's for the biennium that we're in. That's why we need to do it. It's a shortfall as a result of services that weren't provided in crisis shelters because they weren't full, but and that portion of the money paid to the crisis shelters would traditionally have been paid by the feds, but they only pay when their service is provided. But when we had this absence of service because of our contract with crisis shelters, we had that obligation to them. So we're trying to backfill where we couldn't collect the federal dollars in this biennium for that $1 million. Corin, did I say that right?
Mr. Chairman, Representative Larson, yes.
Mr. Chairman,
Go ahead,
just Director, what is that actual number? $1 million seems like it's pretty well rounded off, but how much are we actually in arrears for payment to these providers?
Mr. Chairman, Senator Hicks, at our most recent calculation, we are actually sitting at a need of $750,000. So this amount could be decreased by $250,000.
I wasn't able to hear you. You broke up there for a second. Could you repeat that, please?
Mr. Chairman, Senator Hicks, our need has decreased by $250,000 based on most recent projections. We now need $750,000.
All right, thank you.
Okay. So right now we're just, did we vote on the motion is simply to make it effective immediately.
Mr. Chairman,
Go ahead. Go ahead, Senator Kinski.
I had a question for Don. Don, I thought you said this is one component of Governor's Letter number 17. Okay, I'm looking at 17 and I see outdoor rec, and then I see healthcare related construction.
Mr. Chairman, if I could just jump ahead.
Go ahead.
On page 6, your second item is what is being referred to here, one-time funding for crisis bed stabilization in the amount of $1 million.
Page 6 of Governor's Letter number 17. Well, I must have an out-of-date letter. I see funding of the WWNRT and,
That's the drive and thrive proposal.
well, it's letter number 17. At least it says 17 here.
Second item.
Okay, well, what is this letter, page 6 is completely different from your page 6. Oh, there we go. Okay, gotcha. All right, thank you.
Mr. Chairman, there's two tables. One's ARPA direct and one's the revenue. There's two different tables.
Got it. I'm with you. Thank you.
So this, I think.
I'm surprised we haven't had more of this because there's a lot of
Let me
paper.
look.
I think Tom was wanting to amend his.
Okay, so we'll go back to Representative Walters. Did
Thank you,
have
Mr.
something?
Chairman.
I was
Mr. Chairman, I think I'm going to start by withdrawing the original motion and starting over with a clean one.
Okay,
And so with that withdrawn, I would start over with a clean motion that would be.
okay, thank you.
Thank you. So I would move for $750,000 of general fund with a footnote that says if the general fund can be replaced with ARPA dollars, then it would be replaced with ARPA dollars and make that money effective immediate.
Okay.
So that, Mr. Chairman, if I can get a second, I'll explain.
ARPA directed?
So
Mr. Chairman,
go ahead, Kevin.
we've already identified that this does not qualify for ARPA direct. That's why we made a recommendation to use revenue assistance or general fund.
Okay. Are you unconvinced? Are you going to change your? Right, we'll just take
What
a
color the smoke is.
brief timeout.
I tell you about the time I am.
Mr. Chairman, scratch that. I've been coached that does qualify for ARPA direct.
So, Mr. Chairman, I will again modify my motion. $750,000 ARPA direct, effective immediate for crisis bed stable services only.
Second.
Okay, we got a motion second. So just to further clarify, what this would be reduce the governor's record by $250,000 with these other stipulations. Right? Okay, everybody clear on the question? Any further discussion? All those in favor of the motion?
Aye.
Say aye.
Aye.
All those opposed say no. Motion carries. We're back on anything else on 59, unit 5903. So again, 5903 as amended. All those in favor say aye.
Aye.
Opposed, no. Motion carries.
The next unit for your consideration, you did 5904. So we will move to page 69, unit 5908, Wyoming Children's Trust Fund.
That's right.
Govs Rec, Wyoming Children's Trust Fund. All's in unit 5908. All's in favor, say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 71, 5909, Substance Abuse and Prevention and Treatment.
That's right.
Govs Rec on 5909, substance abuse prevention and treatment. All's in favor, say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 75, unit 5910, Supplemental Nutrition Assistance Program, SNAP.
That's right.
Govs Rec, unit 5910, SNAP. All's in favor, say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 79, unit 5911, Child Support Enforcement.
That's right.
Govs Rec on unit 5911, child support enforcement. All's in favor, say aye.
Aye.
All's opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 84, unit 5912, Childcare.
Govs Rec on 5912, childcare. All's in favor, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 88, unit 5913, TANF, Temporary Assistance for Needy Families.
That's right.
Govs Rec on unit 5913, TANF. All's in favor, say aye.
Aye.
All's opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 96, unit 5915, Local Services. There are a couple of amendments.
Okay.
Mr. Chairman,
Representative Larson.
on page 93, in that unit 5915, there's an exception request on priority number 5, and this is the amount where the governor approves. Last year when we took the step 2 reductions for these payments to guardians, foster cares, RTCs, and group homes. And then in the step 3, we come in and we reduced half of the 3% amount and then directed them to come forward to, if they wanted to continue that through this next session. We put that back in largely because we just thought it was cutting these providers too much. Over the governor in this request puts back, has some funding in here. He puts it out of leisure. We changed that to general fund. That was just an error, but it's general fund. I would like to propose that we restore, in addition to what the governor has done, an additional 1,153,689 general funds, 435,380 in federal funds. If I get a second, I'll explain that a little more. Thank you. And Mr. Chairman, so over the course leading up to, from our budget hearings and through the holidays, I've had the providers from the RTCs, the group homes and crisis shelters call and indicate that they're facing the same dilemma that we see in our state facilities, where they can't get staff to because of the they can't afford to pay them. They took the step 2 cuts, they're taking the step 3 cuts. They would recommend, they would like to, they're just in a predicament to get that, to provide the services on the funds that are there. In visiting with the agency, we reflected on that, and you'll note that the group homes often are the same facilities that provide crisis beds, but we require the communities to come in and participate more on funding the crisis beds. This focuses directly on the group homes and the RTCs. And then it comes back in for those folks around the state that are foster parents and guardian. It puts back to them that full 3% that was cut for the services they provide in taking these children into their home and caring for them on behalf of the state. So, Mr. Chairman, that's my rationale and my proposal.
Okay, thank you.
Mr. Chairman,
Senator Kinsky?
just so I can get some clarification. I think, so the governor recommended putting back 529,686. Is that correct?
Yes.
Okay. And I believe that that is a partial restoration that both bodies supported in the last session with a direction to come back. So consistent with the principle that Chairman Perkins has articulated, we'd be in support of the 529,686. I don't know that we've had a motion to do that yet. I think what you said is, assuming we adopt the 529,686, you want to put another million on top of that, or in lieu of the 529?
Mr. Chairman, so that would be in addition, the combination of what the governor's recommended of 529,686 in combination with the amounts that I am proposing would restore 3% back into that unit of the department.
So Don, can you give me the dollar figure he's proposing again?
It's
Mr. Chairman, I believe the motion is for $1,153,669 general fund and $435,380 federal funds.
And that's an increase over and above what the governor's rec was.
Mr. Chairman, that would be in addition to priority number 5 on page 93.
Thank you. Mr. Chairman, on and against the motion, I think we're okay with the 529,686 that both bodies voted to put back temporarily, with a direction to come back to us this session. But this is a substantial increase over and above what both bodies had approved. So I'll be on against the additional 1.153.
Okay, thank you. Go ahead, Representative Schwartz.
Thank you, Mr. Chairman. I am strongly in support of this addition to the funding for these local services. As an example, I know that the residential treatment center in my community is having significant problems with staffing. And yet at the same time, they track what happens to the clients who go there, for lack of a better word. And something like 83% of them, after leaving the residential treatment center, are never back in the juvenile justice system. That's their success rate. And I can't imagine why we wouldn't want to support these kind of activities to, it's better outcomes for the kids, which is the most important thing. But secondarily, it actually is beneficial to our budget long-term. And by this is an instance where, yeah, we could cut a little money, but in the long term, it will cost us significantly more. I don't understand the rationale for not supporting this. Thank you.
Thank you. Further discussion, ready for the question?
Mr. Chairman,
Go ahead, Mr. Vice President.
I'm just curious with the discussion, as part of the rationale is to increase staffing and stuff. And, we see this all over everywhere. And quite frankly, with the rate of inflation and the other things going on and wage inflations, I don't see that just providing additional money has been a solution to a problem for whether it's private sector or government or any place else. So, I think if we operate under the assumption, if we just provide additional funding and that those people are just going to show up and go to work, I don't know is actually happening anywhere else in the public or private sector. So.
All right, thank you.
Mr. Chairman.
Go ahead, Representative Larson.
So I think making a premise in the business world that if I think there's two components of hiring people. One is if you're a good place to work and all of that, but to say that the funding or the ability to pay them is not a component that's being considered, I think would be mistaken. And I think what these folks are running into as they're in competition, we see statewide for people to work, CNAs, therapists, and the folks that do these types of services. There's competition there, and particularly from the state side. And so I think if we're expecting them to provide these services as a businessman, when in order for me to update my programs, update my safety program, update my salaries or wages to my people, I had to generate more revenue. These folks don't go out and generate more revenue unless it's from us. Now on the guardians and the foster care parents, I smile because we ought to bronze and immortalize all of them for the work that they do, because it's not a money-making objective. It's just the best of humanity that take these children into their home and raise them coming from difficult circumstances. And we've reduced the amount that we're reimbursing them for the services they provide to these children. I think that takes us in the wrong direction unless we have to. And last year, Mr. Chairman, we thought that was what we were going to have to do, but we looked at the extent of these cuts and said it's too much. And I think looking at our revenue picture, I don't argue that moving forward we have to be cautious, but I think that it is an improvement. And on some of these services, such as these here, I think it's worthy of consideration.
Thank you. Further discussion? Ready for the question? All those in favor of the motion say aye.
Aye.
Those opposed, no.
No.
Motion is carried, it sounds to me, but let's just do a division. All those in favor, raise your hand. All right, all those, so there's 1, 2, 3, 4, 5, 6, 7, if I counted right. No, 6. 6, all right. Those opposed? I'm assuming that's okay. So now, yeah, again, that motion carried.
So it's not a complete cram. It's
Only a partial cram
What were
down.
you-
Huh?
What were you on that?
I voted no.
Okay.
All right, we're back on to unit 5915, local services. Any further amendments? So then 5915 as amended, local services, all those in favor say aye.
Aye.
Those opposed, no. Motion carries.
So, Mr. Chairman, what did we just do? We approved Lloyd's increase and we approved the governor's 529.
Yes, the motion was to increase the governor's number by that number. So yes, it went up to, that's real, 1.7 general fund.
We increased it by that much.
anyway, we've got those numbers. We'll get those numbers, but, okay, go ahead, Don.
Mr. Chairman, the last unit for your consideration in this agency appears on page 99, unit 5916 tribes.
That's right.
Motion is Govs on 5916 tribes. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman,
Yes.
as we close out this, I would just like to extend appreciation to the department and their fiscal group. They've, as you recall, over the last 4, 5, 6 years, they really had to clean up this budget and the structure of their budget. It's been so much easier this year than it has in the past. Just commend them for that.
Hey, Corn.
Yeah, there's an atta girl for you, lady and director. And I'll just say that I remember, gosh, it's been probably 6 or 7 years ago. And the budget hearing from the department was a disaster. And this is good. So again, thank you for you. And again, thanks to Kevin. This budget again has just been very nice to work with. And so we just, again, thank you very much for that work. And please convey that attaboy or attagirl to your CFO, Colleen. Thank you.
Absolutely, Mr. Chairman. Thank you. Thank you very much.
Thank you. All right. Next is, what's it?
Tourism.
I thought you wanted to bring and lay that one back till
I
after.
kinda do, but I kind of want you to lay UW.
All right. We're gonna,
Actually, why don't we take an hour and a half break for lunch and then just come back at 1 so we can go work this.
okay, what we're gonna do right now is we're gonna go ahead and recess for lunch right now. So we're gonna adjourn until 1 o'clock. And that we got some work we gotta do before we move on to those other agencies. Okay,
Well, the only exception to that is, Don, do you have a couple either?
unless you've got a
kick
couple
out?
of small ones that you want to pound out.
Mr. Chairman, I would probably direct you to the judiciary or the
Let's do
Department
this.
of Corrections. Excuse me, the Department of Corrections or Department of Education.
We could do corrections.
You want to do corrections? Do corrections.
What number is it? Okay.
What's the size intimidation?
We got to get organized on it. Both sides do. All right, so the only thing constant is change, and so with that, we'll move to Agency 80, Department of Corrections. Don?
Mr. Chairman, the first unit for your consideration appears on,
Before we go,
Where we
on,
did that, do we have a global
that's what I
on
said. I think there was a
reorganization?
global one on this for the reorganization. Is that
Or did we
admissible?
do that the first day, or did we did do that?
Mr. Chairman, you already did that, yes.
Okay.
We already did that. All right.
Mr. Chairman, the first unit for your consideration appears on page 28, unit 103, WHCC Commissary.
That's right.
All right, motion is Guzarek, Unit 103, WHCC Commissary. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 33, unit 104, Wyoming Women's Center Commissary.
That's right.
Guzarek, Unit 104. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 38, unit 105, WHF Commissary.
That's right.
Motion is Guzarek on Unit 105. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 43, unit 106, Wyoming State Penitentiary Commissary. Mr. Chairman, the agency responded to your concern during the agency hearings regarding the 100 series being just $13,582. They have come back and there is a request to increase this by $133,451. This is all special revenue generated from the commissary. 133,451.
As amended.
All right, there's a motion. I took that as a motion, Mr. Vice. Chair. Second? Did I hear a second? Okay, yes, okay, did hear a second. All right, thank you. Discussion. All ready for the motion? Those in favor, say aye.
Aye.
Those opposed, no. Motion carries. So we're back on Unit 106 as amended. Anything else? All those in favor, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 48. Unit 109, Wyoming MCI Commissary.
That's right.
Mr. Chairman,
Is there another one?
there is another one of these. You'll see they had populated $12,000 for their compensation. The correct number is a increase of 132,445, 132,445,
As
All
amended.
special revenue?
all special revenue.
Thank you.
An increase to special revenue on page 48 of $132,445.
As amended.
Okay, so we've got that motion. We got a second. All those in discussion, all those in favor, say aye.
Aye.
Those opposed, no. Motion carries.
As amended?
Yes.
As amended, excuse, thank you. So as amended, all those in favor, say aye.
Aye.
All those opposed, no. Motion carries. Thank you.
Mr. Chairman, the next unit for your consideration appears on page 53, Unit 201, Co-Assistance.
That's right.
Gov's rec on Unit 201, communication assistance. All those in favor, say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 58, Unit 203, WHCC Assistance.
That's right.
Gov's rec on Unit 203, WHCC assistance. All those in favor, say aye. Aye. Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 63, Unit 204, Wyoming Women's Center Assistance. Mr. Chairman, this also has an issue with the 100 series. This would require an increase of $159,427, the funding source being from SR.
As amended.
Got a motion and a second. Go ahead.
Don, all the rest of those, the other ones that we did, raised it up to the base budget from 20 to the base budget. This one went way over. Is there any explanation? It was a 97 and your amendment that we just seconded went like 153. Did I
Mr.
miss
Chairman,
it?
Go ahead, Don.
Mr. Chairman, I think I would defer to the State Budget Department. It appears that both the health insurance benefits as well as the base salary were modified upward.
Okay.
Okay.
That's
Kevin, do you have anything to add?
Mr. Chairman, Don's observation is correct.
okay. Thank you, Mr. Chairman.
All right, thank you. And again, this is special revenue. All right, special revenue it is. All right, all those in favor, say aye.
Aye.
Those opposed, no. Motion carries.
As amended?
Thank you. So Unit 204 as amended. All those in favor, say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 68, Unit 205, WHF Assistance.
Unit 205, motion is Gov's rec, Unit 205, WHF assistance. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 74, Unit 206, Wyoming State Penitentiary Assistance.
Gov's rec.
Gov's rec, Unit 206, WSP assistance. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 79, Unit 209, WMCI Assistance.
Motion is Gov's rec, Unit 209, WMCI assistance. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 83, Unit 1001, Administrative Services Operations.
Gov's rec.
Gov's rec, motion is Gov's rec on 1001 administrative service operations. All those in favor say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, if you could just pause one.
You bet. We did.
Thank you, Mr. Chairman. The next unit for your consideration appears on page 90. The unit is 1002, Education and Programming.
That's right.
Gives rec on unit 1002, Education and Programming. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Next unit for your consideration appears on page 95. Unit 1003, Chief Finance Operations Administration.
That's right.
Gives rec on unit 1003. All those in favor say aye.
All right.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 101, Unit 1004, Investigations Unit.
Unit 1000, motion is Govs Rec 1004 Investigations. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 105, Unit 1011, WDOC Administration Director.
That's right.
Govs Rec on unit 1011, WDOC Administration Director. All those in favor say aye.
Aye.
Opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 110. The unit is 1012, Inmate Housing.
That's right.
Govs Rec on unit 1012, Inmate Housing. All those in favor say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 113, Unit 1018, Recruitment.
That's right.
Govs Rec on unit 1018, Recruitment. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 118, Unit 1019, Training Academy.
That's right.
Govs Rec on unit 1019, Training Academy. All those in favor say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 127, Unit 2011, Offender Management, and there is an issue here.
That's what we're here for, issues.
I believe there needs to be a reduction of 1 FTE and $225,847 from ARPA funds. You'll recall during the presentation, there were a couple of units where the total number of FTE did not add up. So they had one too many FTE here. It should be -4 rather than -3. And 225,847 ARPA money reduced.
So then is there an offset on that someplace else, or how does it balance out?
Mr. Chairman, I believe that was already incorporated into the other division. So the other half of it was already in the budget. And this was a double count of
So
the
just tell us what the motion is
Just reduce the number of employees by one.
correct.
Employee count by one.
and the number.
And the number is 225,847.
So move.
Mr. Chairman, I believe that position should be shifted to unit 102. 1002.
All right, so we're gonna have to go back to 1002 and fix that, but why don't let's do this half here. Are we all on, are we, let's give these folks a second, make sure that Kevin and budget, state budget and also are on the same page.
Yes, Mr. Chairman, we should be moving the positions in the fund.
If they're not on the same page, there's no hope for us.
No. Did I tell you about my meeting?
Yeah. All right, so we've got the motion. I think we have the motion. Everybody understand the motion? All those in favor of the motion, say aye.
Aye.
All those opposed, no. So that puts us back on,
Now do we go back and open one?
let's go ahead and finish 2011 as amended. All those in favor of 2011 under management as amended, say aye.
Aye.
All those opposed, no. Motion carries. So we're going back to unit 102
1002.
or 1002.
Is that correct, Don?
Mr. Chairman, I believe it's 1002.
And move to add or subtract.
Add 1 FTE and 225,000.
867.
So move.
847.
47.
Okay, so moved. We got a motion, we got a second. I rescind the motion. All those in favor, say aye.
Aye.
All those opposed, no. So now I'll again on 1001 as amended. All those in favor, say aye.
Aye.
All those opposed, no. Motion carries. I'm
Yes.
sorry, 1002, I misspoke. So ixnay on the last ocean may. So anyway, we'll go back to 1002, unit 1002 as amended. All those in favor say aye.
Aye.
All those opposed, no. Motion carries. So,
Mr. Chairman, I believe the next unit for your consideration appears on page 131, unit 2013, split sentencing.
That's right.
Gov's rec on 2013 split sentencing. All those in favor say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 136. Unit 2014, House Bill 31. And there is an issue here. With this one, we need some direction. If you approve it, the governor has denied it, so there is no money here. But if you approve it, we need, based on your agency hearing, some consideration of whether this is a standard budget or you wanted to wait and require an exception request next time. You recall this was the alternative sentencing discussion, and there was some apprehension to, if you were to restore this, restore it permanently, you wanted some continued dialogue with the agency, I believe. But if you don't restore it, no issue.
So it's just a question whether it's going to go in the standard budget or whether it's going to come as an exception request.
And the purpose of questioning it is just, at the time, it was a money issue, was it not? Was it the program itself? Kevin, you call?
I have a recollection. But go ahead, Kevin.
Mr. Chairman, this is a legislative prerogative, and we're seeking advice if you'd like to have this in the standard budget. I think the conversation that we had previously was give it one more biennium, do a review, do an exception request predicated on the review of the results, then consider a standard budget. So the governor's denied this. So if you want to have it for the biennium, you put it back, dollars back in with the sideboards I just discussed.
Mr. Chairman.
Can you remind us what the House Bill 31 was? That was a judiciary bill that came out for.
Yes, Mr. Chairman, yeah, if I may, yeah, House Bill 31 dealt with reforms to probation and parole. The goal of reducing recidivism and among other things was saying your maximum amount of probation would be 36 months, because if you survive that, you're unlikely to be revoked in month 42, things like that. Part of that recommendation was to say that your likelihood of recidivism is much less if you get substance abuse treatment. And so that's where this money comes in. My question on this, if I may, Mr. Chairman, is if we adopt the governor's recommendation, does money get spent or not? Because it seems like the governor's denying the request, but then he wants us to spend the money. So I can't tell what accepting his recommendation means.
Mr. Chairman,
Go ahead, Kevin.
this is a legislative initiative and we want to collaborate with you on this. So if it's the will of the legislature to proceed with this fund, you overturn the governor's recommendation, fund this for the next biennium. And if you want to have a review done in that time frame, then we consider that and then come with an exception request for a standard budget. It was silent on the instructions on what we should do in the budget when we received this.
And so Don, what we need to do, Mr. Co-Chair, is, I mean, we've got to give this directive, if we do this on a one-time basis, to the Judiciary Committee, so that they, and they work with corrections to actually perform this and get it done, and probably put it as an interim topic so that it moves forward. Is it, Representative Stiff, does that make sense?
Mr. Chairman, it does. I mean, and as far as the money goes, I think it's a good value. So I'm in favor of the money.
Go ahead, Representative Larson.
Thank you, Mr. Chairman. And so the way I'm understanding this in my, to whomever, is we funded it previous for one biennium? Or is this the first one, Kevin?
It was funded with legislation in a bill previous.
For last time. And so we should have some results. We just don't know what all of those are. And so if we fund it for the next biennium, we could have further or additional data to determine whether we want to have it as part of their standard budget or not. So, Mr. Chairman, if I may, I would make a motion that we fund this for the biennium only with the requirement for the Department and Judiciary for the department to provide Judiciary Committee a report on the success or failures of the program so that we can reconsider it next biennium for funding and the status of that funding.
Yeah, and that would probably need to be at least biennial reporting
Yeah.
so that they can monitor it as it moves up.
So as part of your motion, would you be including this in the standard budget, or would you have it come back as an exception?
I would have it come back in the next standard budget
Okay,
session to consider what we do with it then.
okay, so it would not be moved into the standard
would not.
budget. It would just be,
So the reporting is every 6 months.
okay, so there's the motion and the second. Don, do you have anything else to round that out?
Just one comment. It's our standard one. You know, any reports in the budget bill are subject to governor's veto, and he has indicated he will do so.
Okay. But then the other thing I think we want to do is we want to send a letter from the two chairmen to the Joint Judiciary to have them follow up on this. So regardless of whether it's whether it's veto, whether it's line itemed or not, it won't matter. They started it, they need to finish it.
We ought to send them both to Judiciary and Management Council. So that they
Yeah.
know that when we're going.
Good point. Good point. Okay, everybody understand the motion? All those in favor say aye. Aye. Those opposed, no. Motion carries. We're unit 2014. Anything else? Anything else? Unit 2014 as amended. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 141, unit number 2015, Sanctions, House Bill 53. Mr. Chairman, the same issue applies here.
Thank you.
I would do it, Mr. Chair, I would make the same motion.
I'll second that. Okay, any further discussion? Don, do you need anything you got?
No, just to be clear, you would be adding $1.623 million.
Yep. All right. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, just for a clarification point, would we be using ARPA for those? I think we would be. And that would
Yes.
help us.
Which ARPA?
Direct.
Thank you.
Direct. They both qualify?
Yes.
Absolutely.
No, Mr. Chairman, this is not direct ARPA. These
Okay.
are conserved general fund ARPA.
Mr. Chairman.
Go ahead.
First of all, we have to spend the ARPA dollars. And we're challenged with this conversation about, does that mean ARPA direct? So we spend the ARPA dollars first, and then that allows us to conserve that.
Mm-hmm.
So I'm requesting that we spend ARPA dollars and then we conserve those in this, on those last two.
Okay, so yeah, okay.
Is that so?
Our nomenclature, Mr. Coach, keeps kind of getting.
Yeah,
us
our nomenclature is getting us in trouble, but on this, over on this side. So Don, have you got that? We're straight on that. Okay.
Mr. Chairman, just so I
Yes.
understand just so I understand what just happened. For example, the 1.62 million on unit 2015, that's not going to come out of general fund. That will come out of ARPA dollars, correct?
Yes.
It's an offset. Let's call one white, one black.
Those are funds that have to qualify.
We agree that that's what ARPA direct means.
And then conservation of general funds would be, once Department of Corrections spends those dollars, then conserve
Right.
When we wrote the P11 for the second half of Biden, for that minute, the governor signing that, use ARPA direct dollars, ARPA money, and it translated over to a conservation of that as well, to where we have the general fund assistance. So I just want to have guidance. What do we want to call it? General fund assistance and ARPA? And just keep it that simple, because there's just a,
We have generally called it, direct ARPA is ARPA qualifying funds. They have to qualify for the ARPA
which corrects
purposes.
that.
So then we've generally been calling it ARPA conserved funds. Is just ARPA conserved funds. And we're all guilty of that because I've noticed even as we went through here, we've migrated around on what we call stuff, but we're trying to do that, but we'll keep pulling our chain on that, Kevin, so we get it right. We don't want to.
We'll keep pulling yours.
Yeah.
So maybe we'll write on a blackboard or something.
Yeah.
So, Mr. Chair, in
Yes.
light of this enlightening conversation, do we need to go back on section 2014 and amend that? Because we had that as general fund, I believe.
So move to reopen.
Okay, so we're back on 2014. So we're doing a motion to clarify that we're using direct ARPA money, correct? That's your motion?
That is.
I'll second it. All those in favor say aye.
Aye.
As opposed, no. Motion carries.
As amended.
So 2014 as amended. Thank you. All those in favor say aye.
Aye.
All those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 144. It's Unit 2016, Community Substance Abuse.
That's right.
Govs rec on Unit 2016, Community Substance Abuse. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 147, Unit 2020 AAOA.
That's right.
Govs rec on Unit 2020. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 152, Unit 0303, WHCC Inmate Medical.
That's right.
Govs rec on Unit 0303. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 155, Unit 0304, WWC Inmate Medical.
Govs rec on Unit 0304. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 158, Unit 305, WHF Inmate Medical.
That's right.
Govs rec on 0305. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 162, Unit 306, WSP Inmate Medical.
That's right.
Govs rec on Unit 0306. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 165, Unit 309, WMCI Inmate Medical.
That's right.
Govs rec on 0309. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 168, Unit 431, WHCC Outpatient Substance Abuse Treatment Services.
That's right.
Govs rec on Unit 0431. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, if the committee wishes to take an in block, there,
All the substance abuse treatments.
So move.
So that'll be Unit 0441, 0442, 0451, and 0461. And also 0491. Would it also include 0492 and 0492? Any others, Don? All right. So on all those, as Govs rec, all those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 194, Unit 1031 Central Services.
That's right.
1031 Central Services. All those in favor say aye. Those opposed, no.
Mr. Chairman, the next unit for your consideration appears on page 199, Unit 1033 Inmate Medical.
That's right.
Govs rec Unit 1033 Inmate Medical. All those in favor say aye. Those opposed, no.
Mr. Chairman, the next unit for
Carries.
your consideration appears on page 203, Unit 1037, Secure Treatment Facility.
Unit 1037, Secure Treatment Facility. Govs Rec. All those in favor say aye.
Aye.
Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 207, Unit 1037, Fund 75, Secure Treatment Facility.
That's right.
Govs Rec on Unit 1037, Secure Treatment Facility. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 211, Unit 1038, Sex Offender Treatment Management.
That's right.
Govs Rec on 1038, Sex Offender Treatment Management. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 215 and 222. It is 1041 Fund 001 and 1041 557.
That's right.
Govs Rec on, what was the first one?
1041, page 215, and unit 1041, page 222.
So 1041 and 1041 both. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 226, unit 2012, Adult Community Corrections.
That's right.
Govs Rec 2012, Adult Community Corrections. All those in favor say aye. Those opposed, no. Motion carries.
Mr. Chairman, the next unit for your consideration appears on page 228, unit 4061,
That's right.
Wyoming Women's Center Vocational Program.
Govs Rec Unit 461, WC Vocational Program. All those in favor say aye. All those opposed, no. Motion carries.
Mr. Chairman, the next units for your consideration both relate to vocational programs. Unit 6061 on page 231 and unit 9061 on
Can we
page
just take all those
234.
vocational programs in block?
Yeah.
Let me just go ahead and read those out, Don.
Mr. Chairman, unit 6061, which appears on page 231, and unit 9061 appears on page 234.
That's right. On those.
Govs Rec on 6061 and 9061. All those in favor say aye. All those opposed, no. Motion carries.
Mr. Chairman, the last division for your consideration is 4,000 prison divisions. We have no notes, no corrections. There are multiple units. If you wanted to do them one at a time, it would be fine.
Why don't you just read off the unit, unless somebody has an objection, why don't you read off the units in Division 4,000?
Absolutely, Mr. Chairman. On page 238, unit 1032, program services. On page 242, unit 3011, Wyoming HCC offender management. Page 245, unit 3012, WHCC offender supplies. Page 249, unit 3021, WHCC facility management. Page 253, unit 3022, WHCC facility operations. Page 259, unit 3031, WHCC administration. Page 263, unit 3032, WHCC food service. Page 267, unit 3033, WHCC programming. Page 270, unit 3034, WHCC education. Page 272, unit 4001, prison operations administration. Page 278, unit 4002, prison programming. Page 282, unit 4011, Wyoming Women's Center offender management. Page 284, unit 4012, Wyoming Women's Center inmate incentives and supplies. Page 288, unit 4021, Wyoming Women's Center facilities management. Page 292, unit 4022, Wyoming Women's Center facility operations. Page 296, unit 4031, Wyoming Women's Center administration. Page 299, unit 4032, Wyoming Women's Center food service. Page 302, unit 4033, Wyoming Women's Center programming. Page 304, unit 4034, Wyoming Women's Center education. Page 308, unit 511, WHF offender management. Page 311, unit 512, WHF inmates incentive and supplies. Page 316, unit 5021, WHF facility management. Page 320, unit 5022, WHF Facility Operations. Page 326, Unit 5031, WHF Administration. Page 330, Unit 5032, WHF Food Service. Page 333, Unit 5033, WHF Programming. Page 336, Unit 5034, WHF Education. Page 342, Unit 5071, WHF Agriculture. Page 347, Unit 6011, Wyoming WSP Offender Management. Page 351, Unit 612, WSP Inmate Incentive and Supplies. Page 356, Unit 6021, WSP Facility Management.
Don, what was the one what was the unit number just before 6021?
6012.
Thank you. Continue.
Next unit for your consideration is page 360, Unit 6022, WSP Facility Operations. Page 336, Unit 6031, WSP Administration. Page 370, Unit 6032, WSP Food Service. Page 374, Unit 6033, WSP Programming. Page 378, Unit 6034, WSP Education. Page 383, Unit 9011, WMCI Offender Management. Page 386, Unit 9012, WMCI Inmate Incentives and Supplies. Page 391, Unit 9021, WMCI Facility Management. Page 394, Unit 9022, WMCI Facility Operations. Page 400, Unit 9031, WMCI Administration. Page 404, Unit 9032, WMCI Food Service. Page 407, Unit 9033, WMCI Programming. Page 410, Unit 9034, WMCI Education.
I move all.
Move all. So the Gov's rec on all of those, just, we're going through, I'm gonna read them off really quick, Don, correct me. What's, right, but first, before we do that, 1032, what was the one right after 1032 and before 3012?
3011.
3011, thank you. So we're talking, so Gov's rec on units 1032, 3011, 3012, 3021, 3022, 3031, 3032, 3033, 3034, 4001, 4002, 4011, 4012, 4021, 4022, 4031, 4032, 4033, 4034, 511, 512, 521, 522, 531, 532, 533, 534, 571, 6011, 6012, 6021, 6022, 6031, 6032, 6033, 6034, 911, 912, 921, excuse me, 9011, 9012, 9021, 9022, 9031, 9032, 9033, and but not least 9034. All those in favor, say aye.
Aye.
All those opposed, no. Motion carries.
Anything else on corrections?
Anything else in corrections? Any letters? All right. All those in favor to close, all those in favor say aye.
Aye.
All those opposed, no. Motion carries. Now we'll stand adjourned until, stand at recess until 1 o'clock. Or do you want to do it till 1:15?
1:15.
All right, we'll stand at recess till 1:15.